Hi guys, welcome back to my YouTube channel. Today we are talking about something that is very close to my heart. Years back, I think 2018, I did this discussion on ENCA and the topic is stuttering. Amalwimi, what is it? So today we're just going to be talking about what stuttering is, what are the signs and symptoms, what are the causes of stuttering, and when should you seek professional help. And October, in fact the 22nd of October is stuttering awareness, so I'm also trying to raise awareness about this condition because a lot of people think, no man, it runs in family, so why should we even treat it? We all go through a period of time when maybe we are learning a language or a child is, learning how to speak, and they go through something which we call normal disfluency. That means that the child is processing information, they stutter there and there, they add a bit of block somewhere so that they can learn how to talk. So in stuttering, the actual condition, stuttering, we all go through a season when we are trying to say a word. So how do you see stuttering in people? Some people may have what we call repetition, where they repeat part of a word, like they want to say mama, mama, so that is them repeating a word. Or sometimes they have what we call prolongation, where they prolong a certain word. They'll go like mama, you see. So, and then in the other one you find that they have blocks, and blocks is when the word is difficult to come out. And I've said that with stuttering there are different types of stuttering. So you will get someone who's been involved in a car accident and now they have a neurological stuttering, where because something has happened to the brain, they are now stuttering. Some people go through a psychological stutter where maybe they've had a traumatic event happen to them, and their coping mechanism is that their body just starts to stutter. There's what we call stuttering, where you look at prolongation, blocks, and repetition. Those are the characteristics of what you see in a child or an adult speech. And then there's also what we call cluttering. So cluttering is when someone speaks so fast that they almost chop through words, and it's also one of the speech impairments. So what are the signs and symptoms of stuttering? People may be adding words or an interjection to everything they are saying. Like I'm in front of you guys, I'm trying to do a YouTube video, and you just hear me going like that's one of the signs of stuttering, especially when someone does it in a prolong. So a speech therapist will then like look at the child's speech or the adult speech and actually take how many times those arms are. Yes, I love my job. We get to do and analyze all of those things. So they will add a word or an interjection such as they may repeat like cookies, 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 and they repeat the same word over and over again. And then they may also repeat a phrase. He is 4 years old if they want to say the child's age. Or they may also not finish. For instance, they may not finish a word. They may say, for instance, his name is, and then because their brain doesn't may not finish the words that they are trying to say, and some of them may even, for instance, if they wanted to say interject, then they just go and say another word altogether. So they may avoid certain words because they know that they stutter in those words. So what are some of the repetition that you can see? You can see, for instance, what we call part word repetition. For instance, when you want to say want, you may just repeat wa. So that is part word repetition. And then you may also repeat a syllable. For instance, go away, and you're just repeating the go, and then they may also prolong a sound or prolong a word. For instance, to say, for instance, it's nice, they may go like nice. So that's they have prolonged the word. And then they may have blocks altogether. The word doesn't come out. For instance, I want chicken, and then the word was not coming out. And I know some people may hear someone who stutter, and then they may like, okay, let me finish your word for you because you can't stutter. Actually, that makes it worse. that makes it worse even when your child is learning how to speak and you finish their word for them. In fact, they feel frustrated, even adults, because now they know their brains, most of the people who stutter, their brains are normally developing, except maybe when we go into neurological stutter, where they have other neurological condition co-occurring with the stuttering. But normal stuttering, cognitively or in their brain, everything is functioning well. It's not, and I would like to repeat this, stuttering is not a sign of a lack of cognitive ability. They may even have a higher IQ than me and you, but it's just that it's a speech impairment, meaning nothing is wrong normally with their language. It's the problem that is wrong, it's where they are speaking, which is related to articulation. So you may also notice that when someone stutter, it is followed by something that we call secondary behavior. In fact, when someone comes to me and I'm assessing stuttering, one of the things that I will tick in my assessment is, do they have secondary behavior? Secondary behaviors are in, like, a stuttering is accompanied by, like, for instance, head nod when they are trying to say a word. Like, some may step on it, some may clench their jaw, and that is learned over time. It's one of the coping mechanisms that someone who's stuttering is using to compensate for the stutter, and normally it develops long after the stuttering has happened. So it tells us about the severity of the stuttering. So some people may avoid certain words, some people may even avoid public speaking altogether. You may find like a child who says in class, I don't want to do the essay, I don't want to stand in front of the class and recite my poem. So they may avoid tasks. They may also feel like they are embarrassed to do any public speaking or anything. If you remember, I think what's his name, Steve Harvey, said that he used to stutter. So where am I going with this? Stuttering, what causes the stuttering? Some of it is family history. So one of the questions that I will ask you when you come for an assessment with your child or with an adult, I'll ask, is there anyone who stutter in the family? And then sometimes it's related to brain differences. Like I say, you had an accident, something happened to your brain, and then now you have a stutter. So brain differences. And sometimes, or most of the time, stuttering affects more males than females. So it's also related to gender. And then, why do we ask all of these questions? On what places are children at risk for stuttering? So, for instance, boys are more likely to have stuttering. We also want to know, when did the stuttering begin? For instance, there is normal disfluency where you stutter because you're still learning a language. But after 3.5 and you have learned the language and you are not exposed to maybe 1 or 2 languages or 3 languages, then you must be, as a parent, you must be worried if your child is still at 3.5, at 4 years, your child is still stuttering. Then you need to actually seek counsel and seek assessment. And then normally, if that stuttering doesn't go away by 3.5, that might mean that child would need definitely intervention, and not stuttering will not go away by its own. And sometimes what can also assist us is knowing in the family history, what are the recovery patterns. Has there ever been people who have had stuttering and now they've gone, or what's the word I'm looking for? They've almost like got healed from it, or they've learned compensatory strategies and they are able to cope from it. When should you seek a professional? If the child's stuttering has lasted for over 6 to 12 months, and your child stutter later than 3.5 years old, and then your child is starting to stutter more often, and then the child starts to tense up when it's time for them to speak, because other children may even go to something we call selective mutism, where they choose not to speak at all because they know that they are stuttering. So when your child starts to tense up during talking, your child is avoiding talking, there's family of stuttering, please seek for professional help. And by that I mean, please seek your speech therapy assessment. Normally you can get speech therapist at your normal clinic, at your hospital, and if your child is at school, please do refer, tell your the child's teacher so that they can start to write. There is something that we call SNA forms, where it's the support document that the teacher can write to recommend that this child must be assisted, maybe from district if the speech therapist cannot be found through their clinic or through their hospital. Schools have access to district officials who can then talk about how they're going to support the child. So how we assessing stuttering? I look at the type of disfluencies. I'll make someone do a reading test depending on the age of a child or an adult. I may do an impromptu speech, normal speech. I may observe someone speaking with someone that is close to them, and I may do reading tasks so that I can get exactly what type of words. There are formal tests that we use to actually assess stuttering, and there are also informal tests. And when I do this test, I get exactly if this person has blocks or prolongation, where are they, what type of speech rate are they using. So you're gonna be talking a lot when you go for a stuttering assessment, because really I'm trying to establish what type of stuttering do you have. Do you have blocks? Do you have prolongation? Do you have secondary behaviors that we are talking about, so that I can tailor make your intervention to assist you. So treatment for stuttering is going to be dependent on how much you are stuttering, how are you reacting to your stuttering, which is also related to secondary behavior, and then how does this stuttering impact the child's life. Is it can they not speak in public altogether, and how old is the child. And then also I may involve, in fact, we will definitely involve family. So there are direct strategies that work with the child. We teach them how to breathe. We teach them depending on where the breakdown is. Is it prolongation? Is it blocked? There are definitely like techniques that target blocks, techniques that target prolongations. And then we may also do indirect treatment, where we help maybe the environment, talking to the teachers, how can they ensure that your child is supported through the journey of their learning. Asking maybe these strategies may also just slowing down. And I know I'm the worst person to talk about this, because sometimes I can have verbal diarrhea. But one of the strategies that we can teach you is slow down. So what is important is that no intervention can work without the assistance of the family. Even with older children, it may also involve writing tasks, public speaking tasks, and all of those other things. But guys, thank you so much. I hope that with this video I've highlighted. Tell me if you need more information about stuttering, and like in terms of how it affects the child in terms of writing. It does sometimes affect the child's writing, and that's why I say I may have reading and writing tasks, because at the end of the day, I want to have a holistic picture, and we based our therapy based on how the child has presented, or based on how the adult has presented in the assessment session. Thank you so much. Do share, do like, and do spread the word. It is Stuttering Awareness Month in October. Let us all support people with stuttering and know that it's not a cognitive condition. They are not less smart than you and me. It's just that they have a speech impairment. I thank you.